Today I'm here with Dr. Melanie Goldfarb.
Hi, thanks for having me.
Dr. Melanie Goldfarb is the Associate Professor for Surgery and Director at the Center for Endocrine Tumors and Disorders, part of John Wayne Cancer Institute at St. John's. Today we're going to talk a little bit about parathyroid disease and hyperparathyroidism. So let's get down to the basics. Where are the parathyroid glands located?
Good question, because usually people don't know that answer. So you have 4 parathyroid glands, and they're located in your neck behind your thyroid. And what I tell people is they're about the size or half the size of my baby fingernail. So they're really tiny when they're normal, and they're sort of sitting in this neck area.
They're so tiny. What role do they have in the body?
They actually are really important. So they are in charge of controlling the calcium for your entire body. And you need calcium in order to survive because it's the energy and fuel for your cell. So you can't not have it. But if there's too much, it wreaks havoc over all of your body systems.
Is that where hyperparathyroidism comes into play?
It is. So what happens is that you can get a benign growth on one or more of your parathyroid glands that just overproduces parathyroid hormone and tells the body to raise the calcium level, and it basically puts on earplugs and doesn't listen to the body signals that says, please stop doing this. So it just goes and goes and goes, like the Energizer Bunny.
Interesting. So does that interact with the high calcium levels or the high PTH levels?
So that's basically what it is. So it produces parathyroid hormone, which is PTH, so that number is really high, and it tells the body, please give me more calcium. So it takes it from people's bones, takes it from the intestines, and it raises the level of calcium to high calcium in your blood.
Interesting. So it sounds like you would find all of this out from a blood panel?
Exactly. It's a hormone disorder, so we diagnose it based on testing your hormones in the blood.
Mm-hmm. So if I came in and I had some complaints, I was showing signs and symptoms, what might those look like?
So there are complaints that are obvious, and then there are complaints that are non-specific. So obvious things have to do with something called osteoporosis. When you have low bone density, it happens most commonly in postmenopausal women. It can happen in men and can happen in younger women. Kidney stones is another big one. If you have gotten more than one kidney stone, your doctor should be testing you for hyperparathyroidism. If you have really bad reflux and ulcers, this can cause or exacerbate it. And then the other common but non-specific symptoms I see a lot are fatigue, concentration and memory problems, and when people just say kind of brain fogginess, and an otherwise healthy, normal young person.
Interesting. So we talked about diagnosis being a blood test. Is there anything else we need to know about diagnosis?
So that's how we would diagnose this, and that's all we would do. When a surgeon has decided to operate on you because it's the only way to cure this, there's no medicine, nothing else, we do other imaging to see if we can find where that bad parathyroid is before we go and operate.
Okay, good to know. So treatment options, just surgical?
Just surgical.
All right. After the surgery, can hyperparathyroidism come back? Do you see recurrence?
So I think that's a fair question. It goes along with there's a lot we don't know about this disease. So recurrence is the word we use, but it probably doesn't mean recur. It probably means that you had another benign tumor on another gland that just was asleep, or sleeper cell as I call it, and wasn't overproducing when we were doing the surgery or at time of surgery, and it decided to wake up at some point later on.
So if we had, I guess we'll say recurrence here, if we had a sleeper cell recur, will we need another surgery for treatment?
Potentially. But the rates I quote people are about 4 to 5% in 10 years. So it's not that common, but it happens.
That is very helpful. I feel like I've learned a lot here today. Thank you so much for your time, Dr. Goldfarb.
My pleasure.